Hello everyone. This video is about why to choose anesthesia as a branch in the next PG entrance counseling. So, there are about 18 to 20 reasons we are going to discuss here and why anesthesia is one of those good ones. Branch is one you have to keep moving with. In this branch, there is no sitting and just writing prescriptions or doing diagnosis on the computer screens, etc. This is the one where the physical stuff needs to be done. You have to be ready at the moment's notice. You are called upon emergencies. You have to be quick in thinking and decide fast. So, this branch is full of adrenaline rush. The next thing is doctor patient interaction. As many of you know, the anesthesiologists work in the OTs, but they also work in wards, the casualty, the ICU, the PAC's room, and they can open their clinics also, where there is ample of patient interaction. Though everything depends upon you. It's your choice. If you want less patient interaction, you can stay in OTs, etc. And if you want, like, no, I want to interact with my patients, so you can open your clinic. And also, it's in wards where you check on patients, the post op, the pre op, everything. ICU includes patient interaction. Though it is short, it's not a long term, but yes, it is there, definitely there. Moving on to the job availability. Jobs are ample. There is actually a great deficiency of anesthesiologists in India and definitely around the world. The jobs where you can apply are government, center, state, armed forces. The private sector is also very much requiring the anesthesiologist. You can also work in groups. Many anesthesiologists work in groups. They go on call basis. They have their fixed days that each anesthesiologist is provided with this. So yeah, and definitely there is an option of opening a clinic like the pain clinics, which are definitely a thing now and definitely have high earning potential. Moving on to the work-life balance, this is the branch if you want to have a good work-life balance to choose. So only some branches in clinical side have good work-life balance. Some may say it's radiology, dermatology, etc. But the third one definitely comes is the anesthesiology. They are fixed working hours. You don't have to go home and be in worry about the patient you just treated, as the thing you did to that patient, whatever that done is done. It stays in OT, doesn't mixes with your work, doesn't mixes with your daily routine life at home. You have time for family and friends and hobbies, etc. So the work life balance is one of the best in this branch. You also have time for friends, family, self, everything you would like normally. So coming on to the stress, this branch is definitely having adrenaline rush, so hence stress is there, but not as much. It limits to the time you are there. Rest, it is a chill branch. You don't have to be stressed all the time thinking about the patient and all, but you have to be alert at the time you are treating a patient, because you are the only one who can control his vitals during the surgery. Nobody else is there, so you have to be a little bit stressed up for the patient's life, which is actually good. Hence, this is the one of the factors for which the anesthesiologists are demanding higher pay, which is definitely a thing should be kept in mind. Next is mobility. There is this special thing about the branch that you don't have to make your customer base. You don't have to. I'm saying you don't have to. You can, but you don't have to. You can move at a moment's notice to any part of the country where your license is valid. You can join the hospital next day and start working there. There is definitely a demand, so definitely you can go to any part of India. That's the most likable aspect of this branch, because in rest of the branch you have like medicine, dermatology, or ENT. You have to have your clinic, you have to get to know your population around them, you have to build your name. But in this, you stay in OT, there is no need. You have to definitely make, if you want to earn really well, you have to make your name among the surgeons and all. But as a young professional, you can move to different cities, experience new cultures, experience new lifestyle. So yeah, that's a one good perk you get with this branch as a traveler. So, the income aspect. The income aspect is good. This branch has really high income prospects. There is no plateau at early stage like some branches, for example, I think radiology and some, but it definitely depends upon the time you give to your profession. The more you give time, the more you earn. The more you are skilled, the more you earn. Even though the years matter, even the freshers get good packages. Also, there is one great benefit compared to all the other branches. That's one of the greatest benefit, that is this branch anesthesiology has the most number of super and subspecialties available. So you have a lot of options available, like the neuro anesthesia, the pediatric anesthesia, cardiac anesthesia, organ transplant anesthesia, onco anesthesia. There's also the regional anesthesia and critical care, which is also the fact, there is a fact in critical care that only the anesthesiologists and the MD medicine can go for this branch. So, and there is many more stuff also there. In society, the value of anesthesiologists is increasing day by day because people are getting to know about the most important part of a surgery, that is the anesthesiologist, the person who takes care of all your vitals while the surgeon works on whatever part he is working on. The anesthesiologist is the one who takes care of the patient. Actually, he is the one who saves the patient. So hence there is the thing that among the other doctors also an anesthesiologist is highly valued. Coming on to timings, the timings are 8 to 2 or whatever the local timings are, and also the emergency duties. This mostly happens in teaching hospitals, but you can also choose your own timings, whatever you are comfortable with. Many hospitals are moving on that system, and you can also definitely be on call. Since the timings are flexible and not that hectic, you can focus on your hobbies. So the thing is, you have the time and money to spend whatever your heart desires. You can do open, you can skate, you can go to clubs, you can do part-time teaching, you can do social services, you can dance, you can do pottery, whatever you like. So this branch has that perk. The working environment in this branch is mainly OTs and the ultrasound rooms. It means mainly the working environment of this branch is mainly the air conditioned and well lit OTs. You don't have to stay in sweaty environments or whatever the stuff is, okay? There is definitely no headache of taking rounds. That's a big one I have seen among the other branches, like the pediatrics, the medicine, the gynecology. They have to take rounds twice, thrice a day. So that's definitely not a thing. It's a chill branch. Anesthesiology is a chill branch. You get to sit between the surgeries. You get to chill. You can have tea, whatever, everything. And you, when you go home, your work is left at place of your work. You are not called if it's not your duty. There are some more benefits here enlisted. You will be the one to save the person whenever you get a call for an intubation or whatever. So you will be intubating, and intubating is the thing that saves the person's in respiratory distress. So you'll be there. So the next one is anesthesia is a cool branch. Or have not seen an anesthesia which is like very agitated all the time, something. They are chill, they have their tea, they have their coffee or whatever food, whatever, and they're chill all times. Even the seniors are chill, even the means this teachers are chill. Take care. So it's a good branch. There is a lot of deficiency of anesthesiologists in this world in India, hence job opportunities are uh, never deficient. So all the time there is a deficiency. You will get job. There is no question in that. A biggest benefit is that there is no setup required. Anesthesiologists are called in hospitals which already have all the equipment and stuff. You just have to be there and give the anesthesia, the everything for that patient. Okay, you don't have to give your input, unlike other branches like in opthal and ENT. These days clinics are coming up. Radiology, you may get, if you want to go in business, you have to give a huge amount of money, you have to get loans for the setup, but here it is not. Definitely there is a concept going around that anesthesiologists can open their own OTs. There definitely there can be some investment, but not many in this field at the moment. So no setup is required. The last perk we are going for is the fellowship options. A lot of fellowship options are there in anesthesiologies. They can be from 6 months to 1 year to 2 year. Definitely abroad fellowships are there. You can, the one point we have missed here, that fellowships can be done abroad. There are adult cardiothoracic fellowship, anesthesiology in critical care, neuro, obstetric, pain, pediatrics, organ transplant, regional, and multiple. Also, there is last benefit I would like to enlist is the prospects abroad. In anesthesiology, some countries of world recognize the PG degree of India. There are some like some Dubai, many countries are there, but most of them, you are required to give the local exam, the language exam, the local licensing exam. Without that, most countries will not accept your degree. That also, the same thing happens in India. When a foreign graduate comes to India, you have to give the licensing exam, which is actually great, because you make the country people trust you, that yeah, you have given this exam, hence the trust thing is there. So that is the thing, but don't worry, those exams are not that hard. You have PG degree, dude. You have PG degree, so you are capable of giving most of those exams. No need to worry. If you want to go give the exam. They are not a big thing. Okay, every other aspect you have to consider, but yeah, that's one is a good. So thank you.